everybody. Back again. My name is Rochelle Captain, President of Connecting Cultures. There's been a lot of conversation around the Code of Ethics. Aaron and I had covered that a few weeks ago and wanted to just continue that conversation, throw out an example with different views and different filters, and just let you know what I was thinking. So here we go. So the interpreter is at an appointment and he's interpreting for a patient, and their relative whispers into the ear that they don't want the patient to hear what's coming next. The interpreter steps in and they clarify their role, saying I'm here to interpret everything. Takes it a step further, and if that's unacceptable to the provider, then they'll just leave. Then from there on, they interpreted everything, which was fantastic, and reaffirmed that while interpreters do work for providers, they're obligated to the patient and not to the relative. So I wanted to break that down a little bit and take a look at the different aspects of that scenario and let you know what I'm thinking. So the first part is that the interpreter is in the appointment and they're interpreting for the patient, and then the relative whispers in the ear to the doctor and says that I don't want the patient to hear what's coming next. Couple of things. One is code is never good. That's what I tend to call it when people are using their language skills to not even privately talk about something, but just speak about it openly when the other people in the room don't understand the language. So one thing that I would ask at this point is, was there a pre-session? So as an interpreter, did you say to the patient and their relative, hello, my name is Rochelle, I'll be your Spanish interpreter today. Just so you know, everything that you say to the doctors and the treatment team, I'll be saying to them, and vice versa. So anything they say, I'll be saying to you. That's really, really important, especially if you haven't worked with the patient or the provider before. You may think and assume, there's that word assume, that they understand what it is to work with an interpreter or what the guidelines are, but you can never be sure. So a quick, hey, this is my name, this is what I do, then you don't have issues where people think that something's happening. The thing that kind of catches me here, though, is that the interpreter heard that the relative was talking to the provider in English, that they didn't want the patient to hear what was coming next. Why didn't you interpret the side conversation? Side conversation is so, so important. That's what keeps the communication real. That's what keeps people feeling like this is a natural situation. And as interpreters, we don't know what is or isn't important. I can go into some stories at a different time, but it's really important to be saying everything. And in this situation, if the interpreter had interpreted what they heard between the provider and the relative, the patient would have heard that. That would have empowered the patient, and there would have been a dialogue. The other thing that I'm noting here is that there was a quick jump. And again, this is very, very limited context. But there was a really quick jump from hearing the whisper to, oh my gosh, this is my role. If you don't do something, I'm leaving. And so that's really important to make sure that we're following all of our steps. So we've done pre-session, we've interpreted everything. And the problem that comes in, I think, here, or what could be a cause, is when there's inconsistency in how interpreters deliver the interpreting service, this is the outcome. This is what happens. Because if there was an interpreter that had worked with them before and they allowed the code speak to happen, then the expectation for this particular interpreter is that that's still okay, and it's not. In a bit, we're going to get into the whole the provider side of things. But it's so important that we follow our guidelines and that we follow and stay within the scope. We talked about that in the Code of Ethics video and laying out our platform, I guess, for where we stand. Every time we take interpreting and look at the Code of Ethics as a guide and a stepping off point, nobody knows what we're there for. Nobody knows our role. It's inconsistent always, and it causes problems like this. So the relative whispered, said, don't tell the patient. The interpreter then stepped in and clarified their role. Said, my job here is to interpret everything that is said. Perfect. But it's also important to know that a doctor has the same obligation to a patient. So interpreting and clarifying their role, saying I'm here to interpret for the patient, they need to understand everything that's being said. That's the important part. Well, yeah, the doctor has the same obligation. And one thing that I think we lose sometimes as interpreters is when we walk into an appointment and it isn't somebody that we've interpreted before, and even if it is, in that appointment, we're only seeing a snapshot in time of their entire life. So the provider is going to be much more aware of the circumstance and the situation between the patient and the relative and that whole bit. So it's really important not to jump ahead of the game and start telling providers, hey, this is what I'm going to do, because then they go to, it's unacceptable if you do this and I'm leaving. That almost sounds like a threat. So if you did do the pre-session, if you clarified your role, everybody's going to know that there is no code allowed, that everything is going to happen. So at this point, I would ask and wonder the context around, did you give the provider and the relative and the patient the opportunity to be like, oh, okay, that's what they're doing, and continue on? Or did you immediately step to, and if you don't, I'm leaving? So there are times and places for those things, but when you go from you don't interpret the side conversation, you clarify your role, then you say that you're leaving, that's a pretty quick progression of things. So I think that if they would have said, hey, this is my role, everything would have been fine. Because then they said, oh, well, then I interpreted everything and the appointment went well. Well, again, popping back to that first, why wasn't the side conversation interpreted? Why was that something that was private in that code? Why didn't the patient know that from the beginning? Because maybe they'd say to the relative, excuse me, I need to know what's going on and you have no right. Or maybe the provider would say, oh, yeah, that makes sense. Let's not do that. But everything needs to have time, and when you clarify your role up front, that's a good thing. And if you have to re-clarify, 9 times out of 10, everybody's fine. And so when they say, oh, well, and then I interpreted everything thereafter, awesome. That's what you're supposed to be doing. Kudos. And then there was the comment of, well, interpreters do work for providers. Yeah, they do. But we are obligated to the patient and not to their family. Yep, that's true too. So we have an obligation to the provider and the patient and not the family member. And when we talk about, again, really clarifying what is your role, what is your purpose, that's what we need to do always in order for something like this to happen. So that's where I'm coming at it from. That would be kind of my coaching feedback if somebody brought something like that to me. Again, that was very limited scope. It lacked a lot of context, but just based off of what happened and what came through, those are the things that I would suggest. The next side of that, however, is the provider, and it is the healthcare team. And if there's a gap in understanding, then we need to start closing that. Providers need to know that we do follow a code of ethics. So we are supposed to be accurate, we're supposed to be impartial, we're supposed to be trustworthy. Some of that may have been jeopardized in the example. And so providers need to really look at what our role is, because then if they don't adhere to it, then you know as a provider, hey, this isn't the way it's supposed to be. This isn't working. And it's really easy to tell if an interpreter is doing their job or not. And we'll pop to that in a minute. Please know that interpreters aren't social workers. They're not caregivers. They have a very specific role in facilitating communication. The patient is your patient, not the interpreters. So in understanding, if you understand the interpreter's role, you don't walk into your nurses or phlebotomists or patient service reps or any of the other people within the healthcare system and tell them how to do their job, right? Because you know they know how to. And there might be, we are all in workplace environments, so there might be some issues here and there. But overall, understand, and can expect what they're gonna do in their role as a professional. You need to know the role of the interpreter. It's so important. Just talked to somebody the other night, and they went to, I think it was an appointment that had to do with some heart problems. And so the provider had an interpreter there, and it was, do you have pain? Is it here? What does it feel like? It was a whole list of not complicated questions, but they were obviously trying to hit a very specific understanding of what they were feeling. And the interpreter says, are you in pain? Well, if you're a provider and you're asking, let's say, a series of 5-10 questions, and you hear the interpreter say one sentence, that's a clue. Something's not right here. And so the patient then went on into describing their pain, how they feel it, when it happens, what's going on, and the interpreters told the provider, yes. So at that point, the family member whose works as an interpreter was like, okay, hold on a second. They're trying to stay back, be able to be the family member and not have to fill the role of the interpreter as well and have that conflict, right? They're like, I'm stepping in, because the interpreter said to my family member one thing, and you said all of these different things, and then vice versa in the other direction with their family member. So you as providers need to know those things and need to understand that, and even looking at a code of ethics or asking questions or digging in, that's important, because that an interpreter affects the outcomes of your patients. They affect the outcome of your work. And so without knowing their role and how they fit, it's complicated and it's difficult to manage the situation. With interpreters, the purpose of their work is to maintain your rhythm. So every time you walk into a room, you say hello, you check in, you ask similar questions, your greetings, you have a whole process and a rhythm, and you repeat it over and over and over again every time you walk into an exam room. The interpreter's job is to make you not have to break that rhythm. So you should be able to be expressive and have conversation and really get to know your patients, even though an interpreter's there. That relationship doesn't depend on one person. It depends on good interpreting. And so if you're not able to maintain that rhythm because you don't trust the interpreter, well, then you're going to be verifying and asking multiple questions, and you're going to be uncertain, and everything's going to get wonky, and I don't know, wonky's my word lately, but it's just going to get weird. And if it starts to get weird, something's not right. Something's off. The other piece that is really important to discuss is that when we're having conversations and saying the word provider, we're really talking about the treatment team. And so an interpreter's role is to be there from the time that a patient walks into the building till the time that they leave. So it's equally as important. There's a lot of money spent on pretty waiting rooms and smiling faces and people that are there to greet and to say hello, to make people feel comfortable. This is all part of healthcare and the healthcare system. And interpreters are able to help deliver that to all of your patient populations. But you need to know that, and you need to know how to work with them. And then finally, what's I can't express this enough. There's all sorts of debate about an interpreter's role, who they interpret for, what they should do, how it rolls. If as a provider it's not working for you, you need to speak up. It's important for you to speak up. Don't just accept whatever, because that reflects on you. And we all know that if you've dedicated yourself to healthcare, you care about everybody. It's not an interpreter versus provider, interpreter versus healthcare. That's not a good argument, because we're all here for the same reason. We just have different roles and functions within the system. So if as a provider, you're not getting services, you're not communicating, you don't feel good about what's coming, talk to your buyer. It's hard to find them, but talk to them. Buyers don't know the user experience. They hear all the marketing, they hear all of the messaging, they hear all of these things, and so it's like, oh, this is, most affordable, and this is gonna be great, and this is gonna be fun. Well, we've all experienced it. There's different modes, whether it's telephonic, or it's video, or if it's in person. There's different modes that work sometimes in some places, and they tank in the other. So if you're not speaking up as a group, as a community, to the buyer, to the business part, to the corporation, nothing's gonna change. You're gonna keep on getting poor service, it's gonna keep on getting frustrated, you're gonna be going to Google Translate, you're gonna be going to the family member or friend, because frankly, that can be a lot better of a service and quality than what you're getting from interpreters. So interpreters, we gotta get it together. And providers, we need you to engage and start understanding and seeking knowledge as to the role of interpreters, because it doesn't have to be us versus them. We need to come together. So it's a lot of stuff off of one scenario, but wanted to give a little bit of feedback as to where I stand. As moving forward, it's probably going to be similar, where there's the interpreter side, but we have to start engaging with the healthcare community and hearing what they have to say as well. So thanks a lot and have a great day.